Today we are going to see the technique of one more bariatric operation which is proven to be a very useful operation in Indian scenario. That operation is called as laparoscopic Roux-en-y gastric bypass. This operation is again performed through small keyholes which are using the laparoscopic instruments, the long instruments with a small functional tip. This operation, once we enter the abdominal cavity, we inspect the complete abdominal cavity to understand if everything else is fine. Then we look upon the stomach, and the stomach is converted into two pouches. Upper small pouch which is almost 30 to 35 ml capacity, and the lower pouch which is the rest of the stomach. Once the pouch is created, we move down to the smaller intestine, and in the small intestine we disconnect the small intestine at a certain level from its origin. From the origin, almost 150 centimeters or 75 centimeters. In between these two distances, we cut the small intestine and get the second part to the small upper pouch of the stomach. Now, this upper pouch of the stomach is directly going to drain into the second part of intestine, the cut where we have made in the small intestine. The other end of the small intestine, the upper end of the small intestine, is connected to the small intestine at some other level. So typically this becomes an arrangement where the small pouch of the stomach, the upper small pouch of the stomach, is draining directly into the later small intestine, and the large pouch of the stomach, which is in continuity with the small intestine, is draining into that small intestine at some other level. Typically here what happens is, this becomes your food pipe and this becomes your digestive enzyme pipe. So the digestion of the food starts at a pretty later stage in the small intestine. This operation is proven to be one of the gold standard operations as far as the control of obesity, the control of diabetes, and the control of all types of diseases which are associated with obesity are concerned. This operation needs particular expertise wherein it can be done in a very safe way. Fortunately, there are advances in the technical sciences. This helps us create the anastomosis, create the joining and the connection of the stomach and of the small intestine in a very smooth and safe manner. The staplers are the machines which we use to connect the two ends of the intestine or the stomach to the intestine. This operation has got a very strong effect on diabetes and obesity on a very long-term basis, and it needs to be followed with some kind of behavioral changes in terms of the choice of the food, the frequency of the food, and some of the vitamins are needed to be taken as supplements throughout life after the operation.